First thing you need to do when you've taken your Kingon out of the box is to plug in the battery. Open the bag. Make sure you have the hole that is used to connect your power adapters lining up with the power adapter port on the device. Slide that in with the screen going towards the clear plastic, and it's a tight fit so the machine doesn't move too much in the bag. Then pull up the zip and then pull the zip around. Once the Kingon P2 oxygen concentrator has been placed in the bag, you'll notice you've got good access to all the buttons, the display panel so you can see the status, the port connector, and also where you can connect the power cable for your mains adapters and car adapter. You can carry it around in a single hand, or you can use it over your shoulder using the strap. There's also a place here if you have a name card, you can put your details. Once your oxygen concentrator is placed inside the carry bag, you're ready to go. So first thing to do is to put on your nasal cannula. Connect the nasal cannula hose to the barb fitting on the oxygen concentrator. Hold your hand behind the oxygen concentrator so you can push against it and it doesn't move when you're pushing the hose onto the barb. Once your nasal cannula is attached, it's just a matter of turning the device on by pressing and holding the on button. So these devices, like all oxygen concentrators, will start by warming up its oxygen sieve, its filter. They don't start to produce the maximum amount of oxygen until they've been running for at least 10 minutes and that sieve has warmed up to around 30-40 degrees. To turn the device off, you just press and hold the on-off button.